Welcome to the Dispense Magazine podcast with news and information about medical cannabis. We talk about the things you and your doctor might talk about. I'm your host, Sven Hosford. In this episode, it's Cannabis Conversations at Solevo Wellness. This is part 2 of a discussion on medical marijuana for pediatrics. We'll hear from Richard Greer, Director of Pharmacy at Solevo, and Annie Corbin, who runs the Pediatrics program. Recorded live at Solevo Wellness in Pittsburgh on October 20th, 2018. Well, let's get Richard into the conversation here. We've been talking now about the view from doctors and how they've been treating and working with children. You're actually right here where the rubber hits the road, as we like to say. You're actually dealing with the children and their caregivers. Richard, how many of your patients are children here?
In terms of like a hard number, to give you some kind of idea, it wouldn't be uncommon for us to see about 1 or 2 new pediatric patients on any given day. What I typically tell people is Solevo's approach to medical marijuana is very highly medical and very highly clinical. Not only is that our approach as a staff, but I think we're very much gaining that reputation in the industry. So as a result, we are getting a substantial amount of the pediatric cases in the area. So like I said, it's not uncommon on just a regular day to see 1 or 2 new patients. In terms of follow-up, I mean, that's something we really try to drill down on. So when I say 1 or 2, that's solely talking about patients coming in for the first time. What we really try to do with our pediatric department is very much focus on follow-up with the parents and with the caregivers, not only to track progress, but also make further recommendations and try to avoid any issues or any problems that may arise throughout the course of therapy. So from my standpoint, like I said, it's very, very common to see 1 or 2 new people a day. But in terms of follow-up and beyond that, Annie could probably expand a little bit, but we do see a very high number of pediatric cases in the area for sure.
And when the parents first come in, what kind of questions are they most often asking?
It really ranges. It can vary significantly from consultation from one to the next, and from one patient to the next. Some parents understand some of the fundamentals and some of the basics. They understand the cannabinoids. They understand THC, CBD, all these different letters you hear about. A consultation like that is going to take a slightly different course. You know, those kind of questions are going to focus more on dosing. Any concerns in terms of like either starting or continuing therapy. Any of those kind of questions really evolving around the actual practical application and practical administration of the meds, from like a milligram dosage to different dosage forms or whatever the question surrounding that may be. There's also definitely a subset of parents and a subset of patients that aren't quite as informed. They don't even know about the cannabinoids. They're almost like a blank slate. You're starting from scratch. So questions could range anywhere from what is CBD? What is THC? How do you dose this? What dosage forms do you even have available? Times of day to dose, any sort of concerns, considerations, anything about the actual administration, how things interact or do not interact with their traditional meds. So it really can vary from patient to patient and from meeting to meeting. I think
that's a real important point, though, the drug interactions. You need to know all of the different prescriptions that the child is on, and you must have some idea of how the different cannabinoids interact with those drugs, do you not?
Yes, sir. That is a big part of the service that we provide here, is a very comprehensive health history review. Obviously, not only focusing on a diagnosis or the associated symptoms, but also any meds the child is either currently on or potentially would be on in the future. We're going to screen very diligently through that information just to be sure that we don't miss anything. The biggest thing that we want to do is very much ensure any patient's safety, but especially in reference to our pediatric patients. Safety is a huge concern of ours. It's a huge concern for the parents as well, and we want to be a partner in that in keeping their children safe. So absolutely, we would be screening for any kind of medication-related issues.
So that must be a nice change for the parents to have a medical professional that will actually sit and spend time with you, with them, and really go over the entire history. That must be a big change from you have 5 minutes to see your doctor.
Absolutely. We like to think so. We do everything we can to go above and beyond and provide the best service to everyone, but especially our pediatric population.
Right.
Generally, our initial consultation is supposed to be around 15 minutes in a perfect world. It is not uncommon when parents come in, they want to spend 45 plus minutes, and that's fine as well. Really whatever they need is the service here we're here to provide.
Now, a big issue I know is trying to reduce the amount of prescriptions due to the side effects or various other factors. When a patient asks or when a parent asks, can you lower the prescriptions that are prescribed by other doctors, what's your answer to that?
The answer is no. There's no interpretation there. There's no gray area. That's a very definitive no. It's very common for patients or caregivers to ask, how can they either reduce or eliminate their traditional medicines? The thing about a dispensary, and especially here at Solevo Wellness, any sort of changes, any sort of addition, subtraction, adjustments, anything to a traditional medicine, we are not going to directly do here at the dispensary level. That very much gets into issues with scope of practice, issues with different liabilities and responsibilities and those kind of things. What I do tell parents, though, number one, stay optimistic. It's very, very, very possible, very realistic that there should be either a reduction or potential elimination of the traditional medicines. We are not necessarily going to be the ones providing that order, but we can kind of provide the information and kind of encourage parents to have certain discussions with their physicians. Other considerations too, we have actually seen some reductions in traditional medication load here at the dispensary with some of our patients. The other thing I have to tell people, it's not ever really day one. We can get you there, but we also have to be very realistic about this and do things the appropriate way.
So managing expectations is a huge part of your advice that you offer.
Absolutely, yes. I don't want to say that's the biggest part of our job, but it is a very substantial part of our job is making sure that parents and patients understand what to expect. They need to know what to expect from starting a medical marijuana regimen and starting it as a new medication, not only from the standpoint of any potential benefits, but also any potential risk or any potential side effects that we'll obviously try to avoid, but it's providing that education. The other thing too, like I said, every consultation is a little bit different. So depending on the patient, depending on the diagnosis, and depending on the medications, we can set certain expectations in terms of the discussion they should have with their physician or what they should expect. As I had said, there's definitely medication interactions we look for. I don't like using the word interaction because it tends to be a little alarming and I guess cause a little fear for some parents, but there's absolutely no reason to be fearful. That's just doing our job, looking for what is or is not appropriate and kind of providing the information to parents. There is, to our knowledge in the industry, there is no direct contraindication in terms of a medicine you cannot take with medical marijuana. There are certain things we look for, though. The good news is most of the meds that do interact with marijuana are already monitored in some way, shape, or form. So again, it's providing the information, the education in terms of following up with the monitoring. If it's something that's regularly monitored by blood work, really emphasizing to the parents it's important they continue to get that done. Potentially even recommend they get some sort of baseline level to see where the medication stands, and then maybe schedule some further monitoring a little further out. So it all kind of like folds in with each other, ties in with each other in terms of setting the expectations and also giving the education to parents as to what practically needs to be done in this whole process.
So it really does sound like you guys, rather than many times we see doctors as the authoritative voice that says you must do this, you must do that. You guys are actually acting more as a partner, as a helper, as an advisor, as a counselor. You're kind of helping point the way to people, but you're not like dictating the terms or giving people precise instructions that they must follow to the letter.
Absolutely. We always sit somewhere kind of in the middle. We certainly aren't physicians here, nor do we pretend to be, but we do very much consider ourselves at Solevo Wellness to be kind of authorities on medical marijuana, especially when it comes to pediatric dosing. It's kind of a new and interesting realm of healthcare for most people. We don't give a true prescription in this industry. We never will. And we can tell you how to get started. We can give you ideas on dosing. We can give you ideas how to adjust the dosing, but fundamentally, it is not a incredibly set in stone, very regimented prescription like most people are familiar with. So I guess depending on your perspective, some people like to hear that, some people don't. We try to paint that as positively as we can. And again, it's all about providing that information to the parents and kind of making them understand that. The other thing that I always like to hear, usually prior to coming to Solevo Wellness, oftentimes parents kind of feel alone, like they're used to talking to their doctor. They're used to kind of, getting the prescriptions, but especially with these newer products that are coming out, especially with this legalization of marijuana, people have heard of CBD, but they really don't know what it is, nor do they know how to dose it, nor do they know really what to look for or what is appropriate or not. People that have ventured to Colorado, tried to do other realms, try other avenues, especially with their children. Sometimes it's not uncommon for me to hear parents say they're just figuring it out by themselves. Mm-hmm. And that's something that we want to put an end to here at Solevo Wellness. We want to be a partner in this. We want, after your first visit here, we want you to kind of understand we're in this with you. It's not only our jobs. I mean, we're actually invested in the well-being of these children. So we kind of want to put an end to that thought process of, oh, I'm just out here as the parent, just taking on the world by myself and just figuring it out. We're not going to be overbearing. We're not going to be abrasive. We're not going to tell you what to do, but we certainly want to be very, very much involved in the healthcare of your children.
I think it's really positive to not let them feel like they're alone in this battle.
Yes.
Yeah, great. Thanks, Richard.
Thank you.
So let's turn to Annie now. And Annie runs the pediatrics program here at Solevo Wellness. Really glad you could be with us today.
Thank you.
So give us an outline of how the pediatrics program works here at Solevo Wellness.
When patients come in the door, they'll check in at the front desk and notify them if there's any sensory adaptations that need to be met. We have a sensory room in the back. They will then meet with the pharmacist and go over any of their medical needs, and we will find them a medication that will work best. They'll come in and talk with me, but the main aspect of the program is after they leave. The patients really need follow-up care. They need to understand their medicine and understand how it's going to affect their child every day.
So, even for those of us who are fully verbal, finding the right dosage can be a challenge. So I imagine it's even more so when you're working with nonverbal children.
Yes, it is. You really have to work day by day with the parents to understand the child's behavior and the reaction to the medication. And you have to look at all the different components of the different strains that you're using too. Yes.
Yeah. Well, it's a very heartfelt program. I can tell from everyone that works here that they really enjoy having you around and doing this part of it. Was there anything that prompted you to create this program, or what's the need that you think you're filling here?
The children in Pennsylvania have been failed from pharmaceuticals for quite a long time. My daughter was one of them, which forced me to leave the state and go to Colorado to find other ways to get her to have a seizure-free life, and that of which she does. So I'm back here in PA to hopefully give all the children of PA the same chance that my daughter had.
That's really excellent. So now that you've been doing this and Solevo's been open for several months, without giving away any details or privacy, but what kind of results have you seen? And give us some success stories of how the cannabis has improved the lives.
It's been helping epilepsy. We all know that. But autism, Pennsylvania is one of the only states with an autism program. And we really have seen major improvements in kids with aggression and eating problems, sleep issues. Parents are just seeing major improvements daily.
Oh, that's really wonderful. And this is more so than just like with the seizures. You do see a dramatic lessening of the seizures and the number of seizures and their duration. But as you were just saying, the quality of life issues are almost as important.
Yes,
Aggression.
and it's not only the patient's quality of life, the whole family's quality of life is affected. Even watching your child seize daily and having brothers and sisters watch them seize every day is just very, very hard to go through on any family. So to give these families another shot and another chance outside of what they've had is just amazing.
That's great. And what's your one best piece of advice for parents that are considering looking into medical marijuana? What's the first step?
I would say to do some research, talk to other parents, reach out to your doctor. If your doctor's not willing, then reach out to another doctor. Reach out to someone else, because there is a way outside of pharmaceuticals to get relief.
You've got two great doctors right here on the panel.
Yes.
Would you like to see some of the qualifying conditions expanded?
Of course. I think that it should be up to the parent to decide truthfully. We all know our children best, and I think that if you decide to go with a natural form of medicine, then it should be up to you and your doctor to make that decision.
That's great. So you would like to see the doctors be able to recommend it for basically any condition?
Yes.
Well, let's see if we have, I think we have a question.
Let's say the child gets admitted to Children's Hospital. Is the parent allowed to administer the medication in a hospital?
So my understanding, and I could be wrong about this, it's on the basis of the individual hospital. My understanding is there are certain hospitals in Pennsylvania that will allow medical marijuana to be administered. What specific hospitals those are or are not, I do not have the list. That is a big concern for a lot of people, obviously, and that's kind of where certain things have lagged behind. Like the legalization happened and it was tremendous, but certain parts of healthcare, certain parts of law, certain parts of all the practical considerations of this are kind of lagging behind. My understanding is there is a lot of advocacy, a lot of things going on at the state level to try to change certain things, that hospital administration being one of them. Again, I don't have the list and I don't know like the exact black and white letter of the law, but my understanding is per individual hospital, they can kind of determine that themselves. I don't know what Children's Hospital's policy is specifically. I really don't.
I have had at least one patient who's been admitted to Children's since starting on the medical marijuana, and they did run into some problems there. And I won't say what they did about that, but
I did hear
there were some official problems.
Hospital system, supposedly, and I haven't been able to verify this yet either, that uses kind of a lockbox technology where you bring your medicine in, put it in the box, and you and the doctor get a key. So the doctor has to be present when you open that box and take your medicine. I'm going to look more into that, and hopefully we can do a podcast on that in the future. Dr. Spar, if somebody wants to get the medical records for their child, and take it to another physician.
Right.
You are obligated by law to provide that, are you not?
That is right. A patient's medical records belong to them. So a physician can charge you a fee for printing them or sending them, but they absolutely belong to the patient. Your child's records belong to you as the guardian, and they cannot refuse to give those to you.
So if you have a doctor that says, I will not release these because I know you're going to take it to a medical cannabis doctor, they are breaking the law.
Correct.
Okay, that's good to know. We got another question coming up here.
And I don't know if I'm going to ask this right, but in
You still got to get closer to the
epilepsy
microphone to do
and
it.
autism, do you find that you dose with higher CBD for certain conditions or higher THC for certain conditions?
It's generally much higher CBD for epilepsy. However, when epilepsy and autism are combined, you kind of have to teeter on a scale of, because at times THC can increase seizures in children. So you just have to watch closely and track your behaviors and track the seizure episodes and track your dosage really well.
Dr. Spar, any final thoughts or comments?
I think the thing I would say is just that I knew medical marijuana was a good thing before I put my kids on it, but the effect it's had on our lives, it's not hyperbole to say it's been miraculous. It's completely changed my child's life. It's completely changed my entire family's life. It's given us a quality of life that dozens of doctors told us my son would never have. And I just want to strongly encourage parents, don't listen to the hype and don't let your PCP discourage you if that's what they're doing. Persist and do what you know is the right thing for your child, because it really might change your lives in an amazing way.
I like what you said about using your mom gut.
Yes, absolutely. Never doubt your mom gut. Never let them make you doubt that.
Yes.
That's wonderful. Richard, any last thoughts?
Wow, thank you, Dr. Spar. I wish we would have ended with that. That's a difficult one to follow up on.
You got to follow that.
So, in summary, one thing that I really try to convey to parents, especially to kind of just gain the parents that are nervous or unsure about this in any way, even when they walk through our door at the dispensary level, what I try to convey to them, and this is not my words, I'm actually stealing these words from a mother who gave a presentation here at Solevo. She said most people think of marijuana, at least up to this point, more in the recreational sense. Especially parents, they think of what college was like 20 or 30 years ago. The best and clearest way that using medical marijuana with a pediatric patient was explained to me by her was this. She said, if someone like myself, I'm an adult, I don't have epilepsy, I don't have autism. If I take medical marijuana, it kind of takes my central nervous system in its state of homeostasis and kind of throws it out of whack a little bit. And that's what people call the psychoactive effect or the high or whatever you want to label it. With these children, especially these children with autism, it almost has the opposite effect. It takes the CNS it takes the CNS from some level of dysfunction, whatever you want to call it, some level of not appropriate functioning, and almost recenters things. That was the clearest way that was ever explained to me, regardless of if you want to talk about safety profiles or interactions or whatever you want to do. That was the clearest, that put it into perspective for me so perfectly. So especially when these parents come through and their children have autism, I tell it to every single parent now. I don't take credit for it because they weren't my words. I'm solely relaying that information. But I love that. That kind of summed it up very clearly to me.
Excellent. Dr. Shergill, any last thoughts?
I agree, both Dr. Spar and Dr. Gray. It's important to separate recreational from medical uses of marijuana. It's important when you're approaching your physician to see what specifically, because there's still a lot of stigma out there against marijuana, and a lot of this is completely new. So we have to find out what your pediatrician, is it a safety issue for them? Is it a legal issue from them, or is it just basically a lack of knowledge? So that's why it's important to have like formats like this, a podcast or more research, just to find out and have more knowledge on the whole subject and to advertise that knowledge.
Would it be safe to say, do we have a consensus here that you would like to see parents turn to cannabis not as a last resort, but maybe further earlier on in the process?
Definitely. As we get more experience, it will come as a first-line treatment as well.
Well, let's hope that this podcast is going to have that effect on some parents as well. I want to thank all four of our panelists. Let's give them a round of applause.
Thank you.
That concludes part 2 of this Cannabis Conversation at Solevo Wellness. Join us again next time for more news and information about medical cannabis. Thanks for listening. This podcast is a production of Mindful Medicine, LLC.